Hi, I'm Dr. Akshat Pandey, practicing rheumatologist from Indore. Welcome to IRACON-TV. We are delighted to have with me today Dr. Deodhar. He's a rheumatologist professor in Oregon Health and Science University in Portland, USA. We welcome you, sir. How are you today?
Thank you. Thank you so much. I'm doing very well. Thanks.
How was your trip to Hyderabad and how did you find IRACON 2023 scientific program?
So this is my first time in Hyderabad and this is my first time with IRACON.
Yeah.
So I had never been to IRACON before and both of these have been very pleasant surprises to me. The meeting has been outstanding, I should say. I mean, the topics, the speakers, the topics, the enthusiasm of the people who are participating, it's all exemplary. As far as the venue is concerned, that is also excellent. The organization has made amazing efforts to keep me comfortable in the hotel. There is a car which brings me here, and overall, it's a very, very good experience. And the quality of program is, again, scientific program is fantastic.
Yeah. Any topic you feel that fascinates you and brings you great interest in the scientific program?
So I practice. So I'm born and brought up in India. I did practice medicine in India, but I never really practiced rheumatology in India. And what fascinates me is the different risk factors like the infections, etc., and also the different types of patients that you see here. My interest is in axial spondyloarthritis, and people were telling me about the different types of phenotypes of patients with axial spondyloarthritis. They see women with cervical spine involvement, but completely normal, sacroiliac joint, etc. And I told them that you need to publish these things.
Yeah.
Because there may be a completely different phenotype of a disease here. So your question is what fascinates me? What fascinates me is this interplay between the infection risk and how you manage your biologics or how you manage your small molecule treatments in these patients. And secondly, the different phenotypes of the same diseases that we see in US, but how the disease might look very different here, which is very fascinating.
And you gave a talk on recent advancements in management of spondyloarthritis. So would you like to tell us in brief about it?
Yeah, so the talk actually was recent advances in axial spondyloarthritis in general, and there are fascinating things. I mean, number one is the prevalence of this condition is going up in the US, and we don't know why more and more people are being reported to have this condition. And my understanding, my feeling is that it's because of the more aware people become, primary care doctors, orthopedic surgeons. We have something called physiatry, physical medicine, rehabilitation, chiropractors, osteopath. These are the people who see back pain patients and refer them to rheumatologists. So as more and more awareness grows, the prevalence of this condition is going up. That's number one. Number two, advance would be understanding of pathogenesis. In the last, I would say, 5-10 years, there has been tremendous advances about gut microbiome, which was a completely new thing. We have a lab at Oregon Health and Science University, and we look at the gut microbiome in patients with axial SPA compared to psoriatic arthritis, B27 positive, B27 negative, and it's a wealth of new knowledge about the pathogenesis of this condition. Patients always ask this question, why did I get this disease? I mean, one thing is genetics, but the second thing is environmental factors, and lots of new strides being made there. And then the third thing is, of course, management. And at one time, of course, we only had non-steroidal anti-inflammatory drugs, then came anti-TNF, then came IL-17 inhibitors. Now we have got JAK inhibitors. And now there is going to be an IL-17A plus IL-17F inhibitor, hopefully to be approved in the next year. So we have made strides in that as well. And the last thing I want to say is the prognosis, we hope, of this condition is changing, and we are making strides there, and we are really changing the course, the natural course of the disease. So now we are looking at prevention of new bone formation, and I spoke a little bit about that in that session as well. So amazing, good advances and all positive.
So what are the main challenges you face in your clinical practice and management of spondyloarthritis?
Couple of things. Number one is because we don't have a biomarker for diagnosis outside of HLA-B27 and high C-reactive protein, and maybe MRI is a biomarker. Yeah. But beyond that, we don't really have good biomarkers. That is one of the big challenges that we have. The diagnosis is clinical, and we definitely need more biomarkers. We in the sense, Spartan, Spondyloarthritis Research and Treatment Network, we are going to undertake a study. We are currently trying to get some funding called BASIS, BASIS, which is biomarker assessment in spondyloarthritis patient. And we are hoping that will give us some new biomarker for diagnosis. But that is one of the big problems in my own practice even now. And second thing I see is there still needs to be understanding for primary care physicians, chiropractors, osteopath, to send me the patients who they think may actually have a medical reason for their mechanical, what they think is mechanical back pain may in fact be an immune mediated back pain. And so delayed referral is also a problem that I see in my own practice.
So what are your one or two takeaways from recent EULAR 2023 management of spondyloarthritis guidelines?
EULAR had a wonderful, bimekizumab was the main one. Bimekizumab is this IL-17A and IL-17F inhibitor. And there were papers in the EULAR meeting which actually showed improvement in axial spondyloarthritis patients. It's a completely new agent. The other thing which was presented at EULAR was this the first and the only prospective study of secukinumab versus adalimumab, two biologics, one IL-17 inhibitor, one TNF inhibitor, prospectively in patients with ankylosing spondylitis. And the primary endpoint was prevention of new radiographic bone formation. And that was fascinating. This is the first and the only head-to-head study, which showed that both drugs work equally well. But that was actually, those are the two, I think, were the most important outcomes from that meeting. I mean, I can talk about many others, but those two would be the main ones.
Yeah. So we have now generic tofacitinib available in India, so that most of the rheumatologists are using it upfront in treatment of rheumatoid arthritis, of course. So what's your take on use of tofacitinib in spondyloarthritis?
Yeah, I had a good discussion about that in our Meet the Professor session this morning.
Okay.
Tofacitinib is a very good drug for the treatment of axial spondyloarthritis. My only concern is that, and I was talking with the colleagues here, I think IRA should make a statement as to patients who are going to be put on this drug should be vaccinated against herpes zoster, number one. Number two, it shouldn't really be available over the counter. I think that is, people are taking it, I was told, just like methotrexate, or even orthopedic surgeons can prescribe it, and it is a pretty powerful drug. It can cause infections. I met one of your colleagues, and he was telling me how he has seen tuberculosis and POTS spine and bacterial endocarditis in patients with inflammatory diseases treated with inappropriately with tofacitinib. And so IRA is in the great position to come out with official statement as how this drug should be used, what precautions should be done, and it should not be available over the counter. It should only be available by prescription and probably restricted to rheumatologists who understand it, rather than anybody and everybody giving this drug and orthopedic surgeons. I mean, so to answer to your question in short, it's a very effective drug, but it cuts both ways. So you have to be very careful, and IRA should come up with a proper guidelines as to how to use it.
So what is your message to our spondyloarthritis community and special interest groups?
Well, my advice is that a lot of work needs to be done in India. For example, what is the B27 prevalence here? And I got an idea how you can do that. But this is extraordinarily important that we know what is the HLA-B27 prevalence in this country, in this vast country. What is the prevalence of axial spondyloarthritis in the general population? And spreading the message that not every backache needs to go to orthopedic surgeon. If they have got certain, Spartan has come out with new referral recommendations, and those referral recommendations you can try here and see whether that improves referral to a rheumatologist and whether that patients will be diagnosed sooner. And I fully understand referring patients in India is different than referring patients in the US, because people want to hold on to the patient. If I refer the patient, then the patient is going to go away, and all these kind of intricacies are there of practicing in India, which we don't have. We don't really care where the patient goes and goes somewhere else. But so, but that certainly is an important issue in India to get early referrals, timely diagnosis and proper treatment.
So, any last message would you like to convey to our IRACON 2023 organizers?
Well, thank you very much first for inviting me. This is my first IRA conference, and you've done a great job. I mean, the organization is good. The science is very high quality. The speakers are fantastic. And overall, the organization, the conference center, the place where I'm staying, etc., is excellent. I mean, I am very pleasantly surprised and happy that you're doing a great job.
Thank you, Dr. Atul, for coming here, and we wish you all the best for your all future endeavors. Thank you, sir.
Thank you.